Many respiratory diseases require careful nebulizer therapy to improve the day-to-day lives of sufferers. The development of high-performance nebulizers with fast delivery times has helped considerably in the treatment process. The major problem with asthmatic patients is bronchospasm. This is the constriction of the smooth muscle surrounding the airway. Bronchospasm can also complicate other chronic lung diseases, such as chronic bronchitis, emphysema, and cystic fibrosis. Now, all these diseases can vary in severity. However, at some point, the patient may be required to undergo nebulizer therapy. A nebulizer is a device that can convert a liquid into aerosol droplets suitable for patient inhalation. The chamber of the nebulizer unit is filled with a drug. The flow of gas is driven up a tube through the center of the chamber, creating an area of low pressure, which draws the drug up to the top of the chamber itself. The aerosol produced is then forced at very high speed against the baffle, which recycles the large particles. The mist of appropriately sized particles of the drug then flows out of the chamber. The delivery system can be either a mouthpiece, a face mask, or a T-piece. A face mask is easy for the patient to use and is necessary when patients are unable to use a mouthpiece. Care needs to be taken to ensure that the mask is a good fit, particularly around the nose, to prevent drug from getting into the eyes. The disadvantage of using a face mask is that drug can be deposited in the nasal passage and on the face. Mouthpiece is the ideal administration device, as there is no leakage and no deposition in the nasal passage or on the face, which means an efficient delivery of the drug. There are three main factors which determine where in the respiratory tract a nebulized drug droplet will deposit. Droplet size, breath pattern during inhalation, age and condition of the lung. The easiest parameter to control is droplet size. This is the main factor which determines where the nebulized drug is deposited. What we require in a nebulizer is maximum drug deposition in the targeted area of the lung. To judge how a nebulizer performs, we can look at these factors: efficiency, mass output, respirable output, residual volume, nebulization time, mass median diameter. With these values, we can determine how well a nebulizer performs. The efficiency of a nebulizer is measured by the aerosol output at varying particle sizes and is expressed as the percentage of particles of optimum size. The optimum particle sizes are 2 to 5 microns for tracheobronchial deposition, 0.5 to 2 microns for alveolar deposition. Particles larger than 5 microns may be deposited in the nose and mouth, resulting in the drug being swallowed. Mass output is defined as the total weight of drug particles produced by the nebulizer and is expressed in grams per minute. Respirable output is the weight of drug particles produced by the nebulizer of the optimum particle size, and this is also expressed in grams per minute. Residual volume is the volume of drug remaining at the end of the nebulization procedure. The nebulization time is measured from the start of nebulization until the cessation of continuous nebulization, or until the nebulizer starts to splutter. Probably the most simple and useful single measure of droplet size is the mass median diameter. usually abbreviated to mmD. This is defined as half of the mass of nebulized aerosol is contained in droplets, which are larger than the mmD and half smaller.